Good evening and welcome to our special show on cancer awareness, everything you need to know about lymphoma. I'm Anisha Nair Thavan, your host, and today we will be discussing all aspects of lymphoma, where cancer affects one's lymphatic system. This program is powered by AstraZeneca. Now, lymphoma is a blood cancer that affects the body's lymphatic system. Cells called lymphocytes, which could be located either in the lymph nodes, spleen, thymus, bone marrow, or other parts of the body, are affected by this cancer. There are two main kinds of lymphomas. One is the non Hodgkin's, and the other is the Hodgkin's lymphoma. Is lymphoma curable? How is it detected? And how is it treated? We shall cover all aspects of this condition in our special series of shows where we have renowned oncologists joining us to explain the genesis of lymphoma in the human body. Please welcome Dr. Hari Menon, Senior Consultant and Director Haemato Oncology, Director Transplant, Cytecare Hospitals. Welcome to the show, Dr. Menon.
Good evening. Good evening. Yes.
Dr. Menon, is lymphoma the same as blood cancer?
So we would equate it as a type of blood cancer, but it has got its own distinct characteristics in terms of we would otherwise say that it belongs to a cancer that develops in the lymphatic system. But to extricate a lymphatic system away from the blood is probably a very thin line. So we must understand that the lymphatic system goes in close proximity, like small thin-walled vessels, along the other vessels. And it is actually, the lymphatics are actually evolve from the blood in the capillaries, and they drain into the lymphatic system. And the lymphatics goes into stations, which are the lymph nodes, where things are sometimes processed, especially when you have an infection. The microbes are sort of carried through the lymphatics to the lymph nodes, where they are recognized and based on their antigens, and the antibodies are generated to actually take care of or even get destroyed in the lymph nodes for all that. So that's why when you have an infection, for example, in your on your toe, for example, you might get a painful swelling in your groin region, which is basically an inflammatory response, and it is actually an immunological based response to fight infection. So similarly, they have various other functions too, and so they are very rich in the immunocompetent cells, you would say, which are basically belongs to the lymphocytes. And you know that there are so many different, there are two basic types of lymphocytes, which we, to a common man, like the B and the T lymphocytes, which have varying functions. And it's a very complex system, actually. But if you want to say that, in a layman's terminology, what are actually lymphomas? They are basically malignancies that arise from the immune system. Actually, they are largely immunological cancers, disease related to immunity, because the cells involved are basically cells that are related to generating being part of the immunocompetent system in the body.
Okay, so what you're saying is that lymphomas are similar to blood cancers because they can be grouped together, and they're very different from the organ cancers.
Yes, very much.
That is why it is most similar to blood cancer, right?
Yes, it is very similar to blood cancer. We categorize it. So when for example, I tell a patient, in order to make them understand very easily, I say it's a type of blood cancer, I would say.
Okay. So you just said that it is part of the immune system, right? The lymph system. But people told us that it's the white blood cells in your system, in your blood, that fights the infection. So just what exactly does the lymphatic system do? Some people say it's the body's garbage disposal. It gets rid of all the toxins in your body. And like you said, it helps the body's immunity. So, what impact will lymphoma have in the functioning of one's body and one's quality of life?
So when we say there are various cells in the blood and blood forming organs which are responsible for various functions. For example, direct killing of the bacteria, for example, are a function of the neutrophils, which are not commonly seen within the lymphatic system because they are sort of sieved through, and much of the neutrophils are seen actually in the blood, whereas the lymphocytes are rich within the lymphatic system. So when we talk about what are the functions, so neutrophils directly destroy bacteria, whereas the lymphocytes are responsible for generating immunity in the body. So there are various functions for the lymphocytes. For example, the B lymphocytes, as we call it, are responsible for generating antibodies against viral infection. So we are now very familiar with the COVID situation. So just to, in a layman's term, when we say that when you give a vaccine and you generate an antibody, it is generated by a close interaction. Those antibodies are actually generated by the lymphocytes, and the plasma cells, which are eventually sort of matured B lymphocytes. So they are various types of cells involved in the lymphatic system, and each of these cells go through various stages of maturation in the body, and these maturations can occur both in the bone marrow, in the lymphatics, in the lymph nodes, and sometimes even in organs such as the spleen and the liver also sometimes. So you can have an enormous number of malignancies arising from each of those developing cells at various stages of their maturation. So that is why you have different forms of lymphomas that you come across. I can't hear you.
So if you're saying that lymphocytes are in numerous places in our body, but when we get lymphoma, what is the impact on the body? Does it take more specific?
Lymphomas, the manifestations of lymphomas is because of a deranged immune system, and most of the time lymphomas present with swellings involving various lymph nodes. So if you were to ask broadly, which is a commonest manifestation of a lymphoma, they usually manifest as painless swellings involving any part of the body, but mostly at stations, as we call it. You have lymph node stations. Much of them are which occupy the neck, your armpits, the groin region, several of them in the abdomen, and many of them in the chest too. So you have primarily many of these lymph nodes getting involved. They get enlarged, and when they get enlarged, they can cause mechanical problems in terms of obstruction and pressure effects on the edges and organs. For example, you have a swelling in the neck. It can expand indefinitely, and the patient will present with a very large lymph node sitting in the neck, or which is large, mainly painless. Sometimes, when you have affection of the bone marrow, for example, many a time the patient may present with fever. And also, because of the proliferation of these cells within the bone marrow, the patient may present with a bone marrow compromise, which may be manifested as a drop in hemoglobin or a drop in platelet count, or sometimes even a proliferation of cells, as you would find in a leukemia, which we commonly call as a blood cancer. You can see those cells in circulation when you look under the microscope. Many a time, suppose they involve some of the organs, for example, a lymphoma can practically occur anywhere in the body. There is no real area which is excluded from developing a lymphoma. So, but they are largely diseases involving the lymph nodes. But suppose you have a disease, the spleen, for example, is a part of the lymphatic system. So many of them, they present with swelling of the abdomen, and which when we examine, it's an enlarged spleen. So there are varying manifestations of lymphoma. So they can manifest as a tumor. They can manifest with systemic symptoms like fever, weight loss, and unexplained night sweats. They can present with very severe weight loss, and they can present with swellings because of pressure effects. For example, you have a large lymph node in the abdomen, which is causing pressure on the veins, and you have swellings involving the leg. And sometimes they also present with very severe back pain because of involvement of the bones also. So there are varying depending upon where they present, but majority of the lymphomas, they present with lymph nodal swellings. Yeah.
Right. So what you have described to us are largely the symptoms of
Yeah.
somebody
Yeah.
who may have a lymphoma.
Yeah.
But some of these symptoms are very non-specific, like
Yeah.
fever, weight
Yeah.
loss,
Yeah.
swellings. So many, you go to a doctor and say, "You can't forgive, you can't nickel jayegi." Many people have a casual approach to this,
Yes.
and then they will, go for home remedies, hot
Yeah.
fermentation,
Yeah.
because it's painless, right? So
Yes.
they
Yes.
think it's a very routine thing. So
Yeah.
when do you know that this is not routine? It's something really wrong, and I need to consult
So this
doctor.
you're right in saying that many a time this kind of apathy towards taking a medical consult happens because they are asymptomatic for it. But many a time the lymphomas can be very aggressive, and some of the lymphomas even like there is one entity known as the Burkitt's lymphoma, which can double in a day's time because it's got a very high rapidly. So depends upon how aggressive the lymphomas are, which we call as high grade lymphomas. They will present very aggressively with pressure effects, and many of these high grade lymphomas actually present with systemic symptoms as fever, weight loss, etc. But you are right in when you say that it can be non-specific, but any swelling that has been persistent for more than 4 to 6 weeks, which is gradually increasing in size, should be investigated. Though many of the practitioners also would think that this is tuberculosis, which is still quite rampant in our country. But it is also important to think that there might be a lymphoma over there. So the problem of delayed diagnosis many a time happens when we encounter low-grade lymphomas, but it doesn't happen with high-grade lymphomas where patients become symptomatic quite fast, for which they will need to seek attention.
All right. Dr. Menon, so how is it diagnosed? By just looking at it, can you tell what are the
So
steps that patient needs to take?
Many a time the clinical diagnosis can be quite evident when you have large lymphoma. The feel of the lymph node is also one thing. They are sort of relatively soft and rubbery, and you have multiple nodes. For example, the manifestations for a Hodgkin's lymphoma, for example, it migrates from one station to the other. So you suppose you have a node in the neck, and then the patient will say that I had it for about 4 to 5 months, and now I see another swelling in my armpit or another swelling lower down in my neck. So that triggers us to think that, okay, there is a possibility that this is a Hodgkin's lymphoma. Then you take into consideration the age of the patient. There are propensity for certain lymphomas to certain age groups. And also, there is also a propensity for sex distribution. Some lymphomas are more common in females. Some lymphomas are more common in males. But most of the lymphomas are more common in males. And then you would also consider the what we call as the B symptoms. Lymphomas are very commonly associated with the three symptoms. That is weight loss, fever, which is intermittent, and sometimes there is a typical classical fever that we see in Hodgkin's lymphoma. The patient comes and tells you, I have 1 day of fever, then after 3 days I'm okay, then again I develop fever. So something like that, and these all you cannot hold on to one particular aspect for us to determine that, but multiple things. You correlate with multiple things and say that there is a possibility of a lymphoma. But eventually and of course, the first step would be to actually examine the blood to see whether there are any atypical cells. For example, some of the low-grade lymphomas may manifest with certain abnormal-looking cells in the peripheral blood, which can easily be picked up by just looking under the microscope. And otherwise, the diagnosis of a lymphoma is always based on a pathological diagnosis. You need to have a good tissue, remove a good tissue, and never do what many people practice as doing a fine needle aspiration, which many a time can become negative, or it may not provide a diagnosis. So whenever you suspect a lymphoma, the teaching is you always try to get the whole node or a good amount of tissue for us to examine, because lymphoma is just not looking at one particular point. You need to examine the surrounding areas also for us to interpret the diagnosis of lymphoma and also to categorize what type of lymphomas it might be.
So you're saying a CBC and a biopsy. That's how you come to know.
Those are basic tests. So if you don't do this test, so you can even diagnose a lymphoma if you just look at a peripheral blood within probably an hour's time of this thing, but if you don't do it, you're going to miss it, isn't it? You may end up doing several other investigations which may not be really warranted over there. So it is basically important for us to examine in a systematic manner the basic tests. Never ignore the basic tests that are required. That's all.
So could you tell us step by step? Step 1, step 2, step 3, and then
So basically, when a patient comes with a lymph node swelling, yes, we are tempted to do a biopsy from the lymph node, but you try to do your routine blood test, which includes the complete blood count, the peripheral smear. You look at the biochemistry, whether there is any derangement over there. You also sometimes, especially in Hodgkin's lymphoma, you might do an erythrocyte sedimentation rate, which may be sometimes high in Hodgkin's lymphoma. And then you would also look at what is the problem. For example, in some high-grade lymphoma, there are certain biochemical tests like the LDH level or the lactate dehydrogenase levels, which may be very high. Yeah, and in those situations, you can interpret. But at the end of the day, if in none of these things provide a diagnosis, then you have to go ahead and do a biopsy. And once you do the biopsy, then you categorize the lymphomas based on the characteristics. There are so many ways of doing that, what we call as immunohistochemistry markers. Every cell has got its characteristics, and we try to identify those characteristics by putting specific markers for that lymphoma, which will just be positive or negative based on with various permutations and combinations. We are able to identify that. And even the application for markers is based on what you see under the microscope, the pattern of the lymphoma. That is where a good pathologist comes into. And not every pathologist can report. Always a pathologist who is dealing with lymphomas is better suited to make a diagnosis of lymphoma than a pathologist who is just looking at general pathology. So these things are very important. Yeah. And then once you have established the diagnosis of lymphoma, then you go in next for the staging evaluation and to understand where all the lymphoma, because after all, lymphoma is a systemic disease. You can have it anywhere in the body. So you might just identify one point. So you need to find it out another. So that's where the imaging comes into play. So you do the imaging, and currently one of the favored imaging is either a CT scan of the whole body, and wherever there is a PET scan available, if it is a lymphoma, it's a very sensitive test to do. You can do a PET scan, and it's not mandatory, but at least if it is available, you might want to choose that. And then once you have staged it, and once the diagnosis is confirmed, then you plan a treatment for the patient.
All right. So, Dr. Menon, could you tell us what is the Hodgkin's lymphoma and what is the non-Hodgkin's?
So Hodgkin's and non-Hodgkin's lymphoma is basically a diagnosis based on what was described in a specific type of lymphoma, which by Thomas Hodgkins. Yeah, and there are certain specific types of cells that are seen in Hodgkin's lymphoma, which is known as a Reed-Sternberg cell, and we have various patterns of, and so based on that, they are seen only in Hodgkin's lymphoma, and because it was described by Thomas Hodgkins, it is called a Hodgkin's lymphoma. And Hodgkin's lymphoma has typical characteristics in terms of its presentation. It usually has a propensity to involve patients include patients in the second and the third decade, but it is not like as if any age group is exempt from developing it, but you see it more commonly in this age group. And there is a way of pattern of distribution of these lymphomas, what we call as a contiguous spread. They go from one nodal station to the next. So when you have all these characteristics, you tentatively diagnose it as a Hodgkin's lymphoma. Non-Hodgkin's lymphoma are anything that is not a Hodgkin's lymphoma. So, and non-Hodgkin's lymphoma, there are so many different forms of non-Hodgkin's lymphoma. And if you will remember when I said that there are various stages of maturation of the lymphocytes during its entire life cycle, from the bone marrow until its matured status. So you can have a lymphoma developing from any of these stages of maturation, and each of those lymphomas have distinct characteristics and distinct outcomes also. There are some of them which will respond exceedingly well to treatment with complete responses that develop. Some of them are very well controlled. Some of them are not so well controlled either. Yeah.
Right. So I want to understand what are the treatment options, because earlier people used to say, blood cancer, it's all over the body, so it could affect any organ. Similarly, people say, oh, you had a cancer, now it's in the lymph. The lymph also spreads, is like all over the body, your cancer will now spread.
Yeah.
So, do patients come to you worried that this is something which cannot be treated, cannot be cured, it's like a death sentence? What are the treatment options?
So that kind of an answer can be only provided after you systematically evaluate the disease and stage the disease. And you can have lymphomas even in advanced stage disease that have very high cure rates. And you can have lymphomas which are in early stage disease also, where you can probably end up with only a control, or sometimes you may not be able to cure it. But that depends upon the type of lymphoma. And some of them, but on a majority of the lymphomas are what we call as high-grade diffuse large B-cell lymphomas, wherein you are, and even there are various different types among those also, but largely a ballpark figure is that when we treat such lymphomas, we can expect almost 70% of them to be actually cured when you talk about high-grade lymphomas. When we talk about low-grade lymphomas, there are again a whole set of low-grade lymphomas that are there in front of you. And then when you treat them, our intention is to control the disease, and it is never to eradicate the disease. So many a time, many low-grade lymphomas patients can even live with the lymphomas without any treatment required. For example, a condition what we call as a chronic lymphatic leukemia. Sometimes the patient can, you know that the disease is there, but you don't need to intervene, and you will intervene only when there is a problem that is generated. So you need to keep the patients on follow-up. So needs to be treated based, depending upon what the situation merits and what is the type of lymphoma. And for that, you need to have a good knowledge about what we are dealing with, and where we can make the judgment of keeping the patient on follow-up, or where we need to intervene immediately, or where we need to intervene later on.
Right. So, Dr. Menon, how to address the panic that patients may have? Because, like you said, there's so many different kinds, staging is different. So, is it how do you address this panic that comes in when you hear cancer?
So that is because every time cancer is always equated with mortality or death, but that is not the case actually. So my usual catchphrase is that you have a condition that is most of the time cured rather than rather than something that is going to kill you. Yeah. So just treat it less like any other disease that might have manifested for you, and you just have to address it. So my favorite quote is that if you have a pneumonia, won't you get yourself treated? You will get treated and you'll get cured. Similarly, you have a lymphoma, which many a time you get treated and you get cured, but you need to go through the motion. But because if you don't treat it, it's going to progress, and it may end up with even causing compromise, and also may claim your life. There's no doubt. Cancer kills, definitely. But you need to, so it's very important to educate the patient. And mind you, if you are able to educate the patient well, they are more involved with the treatment, including the fact that accepting that you have a disease. And in so situation, which I called you, like low-grade lymphomas, in my practice, it is more challenging to tell the patient that you don't need any treatment presently and keep quiet, rather than just go ahead and treat the patient. So, that needs a lot of convincing, and you need to actually talk to the patient regarding these things. Of course, because even the medical fraternity does not understand lymphoma that well always. So we can imagine what the layperson would be, and many of them come with after Googling, and it doesn't really help for you to understand such a complex disease as lymphoma. So you need to sit with them, and if many a time you're able to convince them, and then deliver an appropriate therapy and take them through the treatment.
But we also want to bust the myths surrounding lymphoma, etc. So would you say that this type of cancer in your practice that you've seen has a high cure rate?
Yes, it is good. It is one of the, I would say all hematological cancers have very high cure rates. Yeah. You experience more cures in hematological cancers than you experience in any other form of cancers. And I would also say that you experience more cure in cancer in general than any other field in medicine, I would say. So, that has to be understood. And it just has to be made clear. it is just like any other disease. It is not because of any fault of yours or because of any habits that you had that you have developed this. And once you have developed it, you just have to confront it and treat it depending upon what merits the situation.
All right. Dr. Menon, earlier on in the show, you said that certain kinds of lymphomas are seen more commonly in men than women. Why does this happen? Are hormones involved, and who is more susceptible to get lymphoma?
No, most of the time you don't have a real cause for the lymphomas, but for some reason you do have certain forms of lymphomas that are more common in females. There are some lymphomas that are associated with with lymph nodes in the chest, what we call as a primary mediastinal B cell lymphomas, which there is a propensity for females to have that. But otherwise, largely most lymphomas are more common in males. If you look at the statistics, in male lymphomas are about 2.9 per 100,000, whereas in females, lymphomas are about 1.9 per 100,000. So that is the way that we look at statistics. So overall, males do have a higher chances of developing a lymphoma, but that doesn't mean that females are far behind. That's all.
Okay, but who is most susceptible? Who gets this?
So it can happen to anybody, but different forms of lymphomas happen in different age groups. So generally, for example, in the pediatric, right from the day that you are born, you can develop a lymphoma right from the day. But largely, you can say there are certain forms of lymphomas that have a propensity for the older age group, and majority of the lymphomas that occur in the younger age groups are usually high-grade lymphomas. Whereas those lymphomas that occur in the older age group can be both high grade and low grade, but you encounter more of low grade. If you look at the proportion of patients who have low grade lymphomas, perhaps you will find a larger proportion in the older age group. So and there are certain types of lymphomas that can occur in any age group. As I told you, Hodgkin's lymphoma can occur in any age group, but generally we say that there is sometimes a bimodal peak, which no longer is accepted so much, but generally we see an increased incidence of Hodgkin's lymphoma in the second to third decade, and again a second peak sometime in the sixth and the seventh decade. So that's the way it is. But there is nothing much to read between the two because lymphomas can occur in any age group, actually. Yeah.
But is there anything that you could have done that perhaps brought it on?
So, and also I forgot to say that lymphomas, as I told you, is a disease of the immune system. So anything that is that suppresses the immunity, for example, HIV infection, HIV patients who are untreated, for example, do develop very high-grade lymphomas and very unusual forms of lymphomas. Similarly, patients who are transplant recipients, like renal transplant patients who are on immunosuppressive therapy for a long period of time, they can develop lymphomas, what we call as post-transplant related lymphomas. Then there are some patients who, but one thing that one should understand, which is a common question, is that it is not familial. Lymphomas are not familial. It doesn't run in the family, for example, although there are certain reports of some lymphomas that have been seen run in the family, but largely they are not familial. It is just because your father or mother had a lymphoma doesn't mean that you are at higher risk for developing lymphoma, like we would equate it in breast cancer or ovarian cancer, like that. Yeah.
Okay, so that's a relief that it doesn't run in families, but and your immunity, if you have HIV or the transplant, you could perhaps be more susceptible. Thank you so much, Dr. Menon, for joining us and talking to us about lymphoma. We shall continue this dialogue and talk more about how it impacts the patient, the quality of their life, more about the advances in treatment, because cancer treatment is getting advanced and seeing new ways to treat with better cure rates on a daily basis. So, and of course, we'll see what is the incidence in India versus what is happening around the world as we have more shows. But thank you so much for joining us, Dr. Menon, and sharing with us your knowledge and experience. I'm sure the audience has learned a lot. I have learned a lot about lymphoma today, and I'm sure everybody has really benefited from this discussion. Thank you so much for joining us.
Thank you. Thank you for having me. Thank you. Thanks.
This program is supported by AstraZeneca. Do follow us on Facebook to get all the updates on our upcoming programs. We will wrap up the show here. Till we meet again, stay safe, stay healthy, and take care. Goodbye and see you soon.